live. I hope last we studied something about the Mater Medica. Now this YouTube live will basically try to answer your questions. That is very important, because YouTube live basically was a question answer session, so that we understand the problems of what you are facing in your practice, and then we'll try to get the remedies or try to get the entry point of the case. So before the question starts, I don't want to start with Mater Medica, because then everybody wants to listen to the Mater Medica, and then the question answer session is not taken care of. So I'll just take a basic symptom where sometimes you feel that this is a very common symptom, but it does not get better with the medicines. I'll take simple case of aphthe, especially in the throat. So this aphthe in the throat, again a very common problem, but sometimes it happens that our common medicines does not work properly. अभी आपने देखा होगा, if you have seen aphthes in throat, if you open the throat and see there are a lot of aphthes in the throat, and the first remedy that comes to mind is Muxol, then Borax, and most of us in our initial day of practice start with these type of medicines only, either Muxol or Borax or sulfuric acid and sulfur and these type of medicines. But there are cases that comes to us where the patient says that he or she is suffering from this simple aphthis for years. They have taken vitamin B12, they have taken antibiotic, they have taken homeopathy, they have taken all the measures, but the aphthis are not getting better. Now I had few cases where I treated aphthe with a very uncommon medicines. Of course, you can have aphthe in the throat also and aphthe in the tonsils also. So first I'll take aphthe in the tonsils, and the very not indicated medicine, especially in aphthe in tonsils, which I remember in my case, is that is I'd given the patient gelsemium. Now when the patient came to me first for treatment, of course I gave the common medicines prescribed as given in the Mater Medica, but it did not work. So my leading question to the patient was, what is the problem you suffer from aphthe? And the patient said that, sir, aphthe is okay. When I get up in the morning, it starts paining and pricking and there's redness, but gradually at 11-12 o'clock I lose my energy, and then I cannot work the whole day. So I found this symptom very interesting, and then I prescribed the patient gelsemium. If you see in your Mater Medica, if you see in your repertory, aphthe on tonsils, gelsemium is one of the remedy. And I had never thought that gelsemium would treat that case. Of course, symptomatically, if you see a lot of weakness, lot of dizziness, lot of drowsiness, lot of letharginess is there in gelsemium, but because of aphthe was a very marked symptom in the patient, and that treated that case. Simple remedy, gelsemium 200 I gave, and the patient was better in 15 days. Now I'll focus your attention to aphthe in the throat. Again, aphthe in the throat, again a very common problem. Again, the same medicines you can think about, like Muxol, like Borax, like sulfur, these are the medicines. But there are few cases in my practice, few cases which I have seen which resolve beautifully with uncommon medicines which I have seen in my practice. And the first remedy which I want to share with you, aphthe in the throat, you must think about Cantharis. Now Cantharis, if you see, a very interesting remedy for urine complaints and burning as such, but I have seen Cantharis very important cases in my practice which I failed with some common indicated medicine, but Cantharis cured that case. The second remedy, again you must think about for aphthe in throat, again not frequently indicated. I had a case of goiter, and this aphthe was his continuous symptom. Every time the patient used to come and tell me aphthe. And I prescribed Spongia in that case. Spongia not only healed the ulcer and aphthe of the patient, but also the patient is much better, the goiter is much better, the goiter is reduced by at least 50%. I started with Spongia 30, then 200, and now the patient is in the LM potency. Are you with me? Are you understanding that? Everyone? So this is in regarding to apnea. And one remedy again you must think about is that I prescribed the case ignitia, and the patient has a very weird symptom of ignitia. Though ignitia is a remedy, is a constitutional remedy, but ignitia had a very typical symptom in that case. I'm not getting the symptom what the patient told me, but I know for sure that ignitia, I gave the patient 200 potency, and the patient was much better. Though the patient came to me for complaints of GERD, he had a problem of GERD and all, and the patient told me, sir, I had these ulcer symptoms for apathy in the throat for so many years. With your medicine, the GERD is better, but these apathy are also better. So remember that case very absolutely transparency that I gave the patient ignition and the patient was better. So think about some non-indicated medicines for a very peculiar disease. Think about cantharis, think about spongia, and think about ignitia. That is my experience. Again, these are my experience. If you open the Mater Medica or the repertoire, you might get a lot of other remedies. Remember, I only discussed those cases, those conditions where I have seen results in my practice. I am not teaching you here what is written in books and what are the symptoms in books. That you can go home and see, but this is only my clinical experience. I hope you understand that. So yeah, Dr. Bharat, Dr. Babal, Dr. Vishaka, Dr. Good afternoon. Okay, so this was very interesting remedies, very interesting cases which I have seen in my practice, and that's why I want to share this knowledge with you. Just an extension to this apathy in the throat. If you have any questions, you can always ask me, otherwise I keep on answering. Yeah, there's a question, so I'll take it first. I am 49 years male, last 7 to 10 days passing stools, sorry, with cramping pain, stool jelly like, and amount small and frequent. And now you see, whenever you have a case where the stools are jelly like, pain in the abdomen followed by stools, especially in hot weather, I don't know from where you are, my dear friend, but then in Nagpur it is 44, 45, so you get these type of symptoms. Every time you get this symptom, you must take the element of summer in this case. Very important, because in sun, this is a very common symptom that we also suffer when we go in the sun. Maybe at one time I have not bought my four-wheeler, I go in a two-wheeler, and then you have a problem. So if it is basically related to a hot weather, my dear friend, do think about that summer problem, otherwise symptomatically I can tell you a lot of remedies. So in exposure to sun and you are having the same problem, think about 3-4, of course, Natramur, Belladonna, or Glonine you can always think about, but apart from this, do think about gelsemium, do think about antim crude, do think about camphor, and one more remedy is Veratrum viridi. These are the very important remedies for summer element, cramps, and stools with mucus. Now, one more remedy that you should think about in summer element, though very rarely prescribed or rarely thought about, you must think about Igil marmelos. It is called Igil mar. Are you with me? Igil mar. Everyone. Igil mar also has this type of symptoms: summer elements, cramping in abdomen, followed by stools, which is mucus. Are you with me? And one remedy, my dear friend, don't forget, because that remedy, if I don't tell you, people will feel, sir, you have not told that medicine, and that is Allosocratina. Allosocratina has a typical symptom of mucus in stools, so please think about that symptom. But if it is occurring in summer, in hot weather, do take that symptom for prescriptions also. I hope this is taken care of, and we can otherwise again go to the throat complaints. We had a lot of okay. So I was just telling you something about extension of apathy or throat complaints. If a patient comes to you diagnosed with cancer, and the patient says that he had a history of apathy, he used to take other medicines, was better, but now the doctor says it was, that time also it was not apathy, it is basically cancer. My dear friend, make sure that you should be very very positive that these type of complaints and disease also can be treated with homeopathy. And the first remedy that you should think about is hydrastis, a very very important remedy. In hydrastis, think two keywords which I found very useful in my practice. Hydrastis is called as the tired retired. He's called as the tired retired. Are you with me? And second remedy you must think about is carbo animalis, my dear friends, carbo animalis. Okay, so let us go. One question: patient has not serious about business, only time passes, no ambition, no future, plain, now age 58, hypertension, alopecia over whole body and forgetfulness. So a very simple case as it appears, matlab, on paper it appears very very simple, but the patient has no ambition. Patient just is living because he is living. So you can always take the patient indifferent. He is indifferent to life. Simple remedy, simple rubric, lot of symptoms, a lot of remedies, just try to add to that. Now one more, if you enter the case by mathematics, I have always told you there is one remedy. Please open Allen's keynote, natrum carp, first line. Patient dislikes exercise, mental or physical imbecility. So patient is happy, just does not want to go out, just want to be happy in life, does not want to do any mental or physical work. And then it is written, in our mathematica, inability to think or to perform any mental labor. Comprehension slow and difficult. Feels stupefied if he tries to exert himself. The only remedy is natrum carp, my dear friends. So materia medica wise, if you see natrum carp, you say, oh my god, this is the case. But basically add a lot of other things in the what you call symptom of the patient. Indifference to life, if you open that rubric, natrum carp is not there, my dear friends. Natrum carp is not there. So this is the problem. Sometimes the rubric is right, your intentions are right, but in that rubric, that remedy which is there in mathematica is not there. Okay. Yeah, if you are doing physical work, that means it does not require a mind. It is basically a reflex action. You can't just sit down at home. For work, you have to earn money. That is a basic criteria of life. But mentally he is not happy to do anything. जैसा चल रहा है चलने दो. Life में there is no interest. So indifference to life. Think about arsenic, mercsol, phytolica, CPI, tobacco. But my dear friend, try to find out that previously he was working well, mentally or physically. What happened? And the patient becomes that type. The change the patient suffered from, that is important in our life. Why did the mind transform from working now to depressive states? If you can understand that, Dr. Saab, then you'll be able to prescribe easily. Are you with me? Otherwise, in the rubrics indifference, you have a lot of sub rubrics. Indifference to loved ones, indifference to life, indifference to joy, indifference to important news, indifference to himself. मतलब he does not care about himself, जैसा है चलने दो. Surprisingly, the remedy is phosphorus and sepia. Indifference to the future, indifference to happiness. I had a very interesting case where he did not enjoy when he was happy. Very, very, typical symptom. I am not happy when I am happy. Indifference to happiness. See the lines of the patient. And I am not happy because I am happy. And you will say, what is the patient trying to tell us? But the only remedy in that is, you have to find out, my dear friends. I don't want to be happy. If I am happy, I become sad. These are the beautiful wordings of a patient. So, indifference to happiness, the only remedy I prescribe to the patient also are silent. And one rubric is there, indifference to everything. Everything is indifferent. Whether there is walking, talking, laughing, wearing clothes, eating food, with loved ones, without loved ones, going out in a holiday, he is indifferent to everything in life. That also rubric is there in my in your repertory. Sometimes a very interesting rubric you can take, if your doctor said, sir, I don't want to go and practice. No, I want to go out, I want to go with my family, I want to go with my family to out of India for a tour, and also his indifference but only to his duties. Are you with me? That the remedy becomes calcarea carb. So there are a lot of sub rubrics in indifference and the matter medica. Told you whatever is there in your case, try to find out why. Why did the patient land up in this position, because of which he became indifferent or depressive state? Mayura Jack, hello, good afternoon. Are you with me? Are you understanding, my dear friends? Understanding is very important. Remedies can change depending on the symptoms. But if you understand the approach, it would be very, very good and it would give you a better result in your practice. Are you with me? So, क्या बोलते? Are you okay? Are you understanding? These are the there was a patient who came to me and he said, Dr. Sahab, I have migraine, but it's okay, no problem. मैं झेल रहा हूँ, he is living with it, he is happy, he said, okay, I know I have migraine and I don't care if I have migraine. I take some allopathic medicine, sometimes homeopathy, sometimes this, and I'm okay. Please treat my uncle, my father, my mother, my this, my that. And sometimes you feel, my God, he is coming for everybody, not to himself. Now, what is the vital force? What is the constitution trying to tell you in this? Anyone? How will you enter this case? How will you approach this case? And what this symptom teaches us? Are you with me? Anyone? He was a case of migraine and he was coming for everybody, for this, for that, sir, he has this. I don't worry about my migraine. I take care, I drink this, I drink that, I drink some medicine, I drink some herb, I take some allopathy, I am happy. Don't worry about my migraine. Don't take care of this. This is also indifference, my dear friend. That's what I'm telling you. Indifference is a very grand generalization, but indifference to his complaints. You can also interpret this symptom as painlessness of complaint, usually painful. Migraine is so painful, the patient wants medicine, but this patient does not care about this, So caring and feeling indifference is very, very difficult. Are you with me? Are you with me? So these are a very, very typical symptoms, personality patients you have to see in your practice. For example, the patient suffers from indifference to his own complaints. Then you can think about opium, think about stramonium, think about hyoscyamus, think about epismel. These are the remedies which I can get it now. So these are very, very, that's what I'm indifference rubric. You don't try to take the whole indifference. It becomes, there are maybe 200, 300 remedies, but try to find out the sub rubrics. Once you try to find out the sub rubrics, then you're able to identify the medicines very, very properly, my dear friends. You have sometimes indifference alternating with despair, indifference alternating with timidity, indifference alternating with vexation, and the remedy changes. Are you with me? Always keep conversing me, telling me something so that I know that people are hearing what I want to tell you. This is very important. Otherwise, I'm talking to a computer and there's no response. That's why I always like, sometimes, I feel that seminars are good. So now in between I go for seminars and it is very live. It is enjoyable. In homeopathy, you cannot master the science. Everybody has some difficulty. Everybody has some lacuna. Everybody has failures. Everybody has it. Just because I am maybe 30 years seniors to you, I have an experience, so I am sharing my experience with you. Otherwise, very difficult to understand homeopathy totally. Nobody can do that. So always share your experience. Always share whether you're understanding or not. There are different ways of teaching mater medica in cases, so that I can change the way of teaching. So everyone, is that okay? Yeah. If you're not, then I can always go for, okay, we'll try to again change something. And now it is summertime, and there are a lot of patient, a student ask me, sir, what medicines to give in summer. Please don't ask me. You can go and ask your teachers and all. Natriumur, calcium, gluonine will be taken care of. But you must ask me, if a patient is not better with natriumur or glycerin or gluonine or pulsatil antiprurate, then how to enter that case? What remedies we have to think in that case? That is very important, because you'll be only remembered and recognized for cases which have not been taken care of with normal or specific medicine. Then you are able to understand by that diagnosis and what remedy you can think about depending on the symptom totality. So in this summer elements, you think about few remedies which are not very commonly prescribed. And that one remedy which I basically want to tell you, think about camphor. I am sure that I had discussed a case of camphor before in my practice. But in camphor, the patient from the sun, he goes home, he just drinks one glass of water from the fridge and just lies down. And for few hours, he can't do anything. He's as good as if he's in delirium, he's in coma. The body becomes totally cold. The house persons are very, the parents and the teach and the associates are very frightened. What happened? And we give natrium, gelsemium, nothing works. But this is a case of camphor, my dear friend. Complete listlessness is a very important symptom of camphor. Are you with me? Camphor. If you open simple Mater Medica of camphor and just read that sentence, anybody, if you camphor, you will be surprised that camphor has a very important symptom. Physically and mentally weak and irritable, and the surface of the body is cold, face is blue. In a case of heat stroke, think about cancer because of the patient says, sir, I went home and I had diarrhea, dysentery, and sudden attacks of diarrhea, dysentery, nose becomes cold, the patient body cold, face and lips blue, hypocritic face, profound prostration. Don't always give natramur or natrum, of course they indicated, but think about camphora. Camphora has given me so good results in case of summer diarrhea, heat stroke and all, where the symptom of prostration is there, diarrhea, dysentery, body totally cold. That is camphora. So one remedy, think about camphora apart from the other remedies. Second remedy that you should think about is Cactus grandiflorus. I think I had discussed Cactus grandiflorus before. Go home and read the Mater Medica, start with allergic keynote, then you can think about whatever books you want to read. Elements from sunstroke, very sporadically indicated remedy. So camphor, one is cactus, and third, think about Arnica montana also. Arnica montana. Now there are a lot of symptoms of Arnica montana, but you have to remember those symptoms in heat stroke. What will happen? The patient goes home and just lies down on the bed and says to his mother, my whole body is paining. Mother wants to massage. No, don't massage. It is pain. Don't touch me also. I'm a lot of pain in my body. It is so much painful. And that is a symptom of arnica, sore, lame, bruised feeling all over the body. So the symptom, what the patient suffers from, is more important. How does the patient behave? That is a very important symptom of Arnica montana. It is said that complains constantly and keeps moving from place to place in search of soft spot, because the body feels, wherever the patient lies, the body feels hard. Are you with me? These are the very important symptom and indications of lot of remedies, but I have seen Arnica works beautifully. One more rare remedy that I've used in my practice, of course, it is definitely indicated for sunstrokes and all, but Sanguinaria canadensis, don't forget this. The patient comes home and says, Doctor Sahab, to his parents and to associates, sir, I have got a splitting headache. Pura Sir, my whole head is totally congested, the head is very heavy. He said it is paining so much. There's burning, there is wave, there's ambulation, and the patient just lies down. Heat in the head and on the head. You must think about cannabis. Sanguinea canadensis. Very, very important. It is said that the congestion is so severe, the patients, there is circumscribed redness of cheek. There is a lot of redness, and you see the patient and say, oh, this is belladonna, because the redness is there and the sun is there. But okay, if you have given belladonna, don't worry. Give second remedy is Sanguinaria canadensis, my dear friends. Very, very important remedy. Do think about this remedy. If it is headache, especially from sun, and the patient says he is better by profuse urination. Are you with me? Are you understanding? The concept is very, very important. So we will not waste time on sunstroke. I just wanted to share some remedies which are not used so frequently, so that it basically helps in your practice. Do also think about when a severe headache, there's throbbing headache, so much headache, the patient is not better by anything. Think about amyl nitrate also. I think if you have not given amyl nitrate any time in your life, you have missed a beautiful remedy. Amyl nitrosum, my advice would be just read Allen's keynote. That's all. Intense surging of blood to the face and head. The patient craves fresh air. He opens up his clothing. The patient comes home. He opens the windows. He takes out his clothes and he wants, fresh air. That is the important symptom of amyl nitrosum, and is followed by great prostration. So prostration is a common symptom in heat stroke, but how the patient behaves in that is your remedy. Of course, then you can go forward and say that what does the amyl nitrate do? It basically is a remedy where the pulse are very retarded, the pulse are very slow, and for nervous and sensitive personalities, that is basically amyl nitrosum. The patient wants to lose up the collar because the collar feels very tight. That is amyl nitrosum. Okay, so understanding how to prescribe and what collar tight. He says, I want to lose the collar, and whenever the patient says, I want to lose the collar, which remedy comes to our mind? Everyone, which remedy comes to our mind? And we normally give that remedy. I used to also think the same way and give the same remedy. Then I understood that these are the sometimes symptoms of a remedy apart from that remedy also which we think. Which is the remedy you think about when the patient says, okay, I want to loosen up the collar. I want the collar to be absolutely loose. Yes, lachesis. Just think about amyl nitrosum also. Okay, if lachesis has failed, then you can think of amyl nitrosum, but do think of amyl nitrosum. It has the same symptom as lachesis. That's why I tell you, if you have never used amyl nitrosum, you have missed a beautiful remedy, and do think about amyl nitrosum when you have these type of complaints. Are you with me, everyone? Of course, we were thinking of throat complaints, but then there are some remedies which are so beautiful written in Mater Medica. For example, if the patient comes and tells you, you open and see the tonsils, and you see white patches in the tonsils. It is called as caseous deposits in tonsils. Of course, there are so other remedies, but I have found when the patient opens the throat, I'm telling throat because now the hot weather, patient drinks cold water, everything cold, and he complains about throat complaints. So whenever you have a caseous deposits in the tonsils, do think about chenopodium. Again, a rarely indicated remedy. I'm telling you this because I have seen fantastic results. When maybe think about you can think about remedies like Hippursulf or Sorinum or a lot of remedies, but do think about chenopodium. Are you with me? Are you with me? This is very, very important. Are you understanding that? Yeah, thank you so much. When you say something, I'm very happy. Also think about one, bowel nosode. I think it is bacillus psychotic compound is a very, very important bowel nosode where there is caseous deposits in the tonsils. Okay. And my dear friend, whenever the patient opens his mouth, you can see the spot. But when he opens the mouth, the whole area, the air becomes like, very, very disgusting odor. Don't ask any symptom. Just give the patient one dose of Sorinum. Cadaverous smell, that is important. Okay. So it's already half an hour up, and thank you for joining me. And I hope you enjoyed as much as I enjoy sharing knowledge with you. Thank you so much. Until next Thursday for Instagram Live. Thank you.